Hello students, today we will talk about the skull. Skull is very important part in our body. So today we will discuss some detailed information about the skull, which is very important for your exam purpose, for your practical purpose, for your demonstration purpose. It is very important, and all type of courses like BSc nursing, MSc nursing, post BSc nursing, and GNM and ANM, they can refer this video for your exam. It is very useful for you, so starting to till end you can use this video, and don't skip any step in this video. So firstly we will discuss the basic information regarding skull. So the skull is a bony structure of the head. It consists 22 bones. 8 bones are the cranial bones and 14 bones are the face bone. These all bones are joint with the immovable joints, which we are called the sutures. So the all bones are joints with the immovable joints, and that joints we can call the sutures in the skulls. Now we can discuss about the function of the when we can talk about the function of the structure. So protection of the brain. Firstly is the main function of that skull is protection, give protection of the brain. It is the skull forms the hard bony case and protects the brain from the any type of injury, any type of accidental injury and other injury. It can protect from the injury. That is the main function of the skull. And after that, formation of the face, our face shape and structure and other extremities, it can protect by the skull. And after that, third function is the support for sensory organs like a mouth, आपके ear, nose, eyes and mouth, the mandible, ये all functions are protected by the skull in our face area. This is also function of the skull. And after that, chewing and speaking is also function of the brain, skull. Take when you have to eating something, when you have to drinking something, so chewing, the first process of the digestion is starting from your skull, which is from your mouth, and mouth is covered by the skull. So that is also function of the skull, helping in the chewing food. And in speech we can speak anything, we can listen anything. Both sensory functions is activated with the help of skull. This is also function of the skull. Then after that, breathing and digestion. Breathing, take breath through the nose and mouth. And digestion, first digestion is starting in our mouth, so that is also function of the skull. After that, attachment of the muscles. Attachment of the muscles is also function of the skull. Many muscles of the face, head and neck, are attached to the skull, helping to movement. Take, if we have to giving and we have to moving any movement, we have to speaking, we have to seeing and smelling. These all movements we can follow, we can do with the help of skull only. So this is also one type of function of the skull. After that, sound resistance. If we can listen some sounds and speaking some sound, both functions are helping by the skull is protecting every organ, every sensory hormones in our face area. So this is the short information regarding the function of skull. We will discuss. After that, we have to go with the demonstration of skull. What are the bones, how many bones in the skulls, and which bone we can call by the name, and sutures and fontanelles, and आपके diameters is also showing in this demonstration. So you will continue seeing this video till the end and take the complete information regarding the skull. Then we can move to the demonstration part of the skull. Thank you. So you can see this skull. We can explain the part of the skull. This part is a nasion. We can call the nasion this part, and up of the nose it called the glabella, and from the glabella to anterior fontanelle, and this is also we can call the bregma. So glabella to anterior fontanelle is called sinciput, anterior fontanelle to posterior fontanelle. ठीक, anterior fontanelle to posterior fontanelle is called vertex, and posterior fontanelle to lateral view is called occiput. These are the part of the skull. And anterior fontanelle we can call the bregma, and bregma is the diamond shape, and posterior fontanelle is the triangular shape. These are the shape of fontanelles: anterior fontanelle diamond shape, posterior fontanelle triangular shape. And anterior fontanelle in newborn close is 12 to 18 month. It means 12 to 18 months. Anterior fontanelle is closed in newborn, and posterior fontanelle is closed till 2 month. 1.5 to 2 month it will closed posterior fontanelle in newborn. So these are the parts. This part we can call the nasion. This is the glabella. From glabella to anterior fontanelle is called sinciput, and anterior fontanelle to posterior fontanelle is called vertex, and posterior fontanelle to lateral view is called occiput. Now we can talk about the bones of skull. That is the mandible bone. We can call the mandible bone. These two bones are called the frontal bone. These are the frontal bone, and these two bones is the parietal bone, and this is the occipital bone. And nearby the ears, these are the temporal bone, both side, this side and this side. So these are the temporal bone. So when we are the discuss about the bones quickly. Revision. These are the frontal bone. These are the parietal bone. This is the occiput bone, and nearby the ear is the temporal bone. These are the temporal bone. Total bone we can call like this. Now we can talk about the sutures. So these are the coronal sutures. This one you can see, these are the coronal sutures, and this is the lamboid sutures. This is the lamboid sutures. This is the frontal suture. This is the frontal suture. This is the parietal suture. These type of sutures we can call like that: frontal suture, coronal suture, vertex, parietal suture, and lamboid sutures. Frontal bone, parietal bone, occiput, temporal bone. These are the bone in the skulls. And nasion, glabella to anterior fontanelle is sinciput, anterior fontanelle to posterior fontanelle is called vertex, posterior fontanelle to lateral view is called occiput. This type of name we can call in this skull. Now we can talk about the diameters of the skull. So there is total 5 diameter in the skulls. One by one we can discuss in this video. So now we can talk about the diameters of the skull. Total 5 diameters is there. First is the submentobrachmatic diameter, which is 9.5 centimeters, and this diameter we can show in the face presentations during the delivery. At the time of delivery, in the cervix area, we can assess the face presentations. If we can see the face presentation, then submentobrachmatic diameter is present at that time. What are the subbrachmatic diameter? Subbrachmatic diameter is started from the mandum to brachma. Mandum to brachma. This is the brachma part. This is the mandum part. So mandum to brachma is called the submentobrachmatic diameter, and this diameter length is 9.5 centimeter. And this diameter we can assess in the face presentation at the time of delivery. Now we can talk about the suboccipitobrachmatic diameter. Suboccipitobrachmatic diameter. सब occipitobrachmatic diameter, brachma ये हुआ हमारा, this part is the brachma to occiput. This is the occiput. brachma to occiput called the sub-occipito-brachmatic diameter, and this diameter is also 9.5 centimeter, and this diameter we can assess in the flex vertex positions at the time of delivery. In front of cervix we can assess the presentation part is flexed vertex, and this is the sub-occipito-brachmatic diameter, which is the 9.5 centimeter. Sub-brachma is this part and occiput is this part. So brachma to occiput diameter is called sub-occipito-brachmatic diameter, 9.5 centimeter. After that, third diameter is the manto-vertical diameter. Manto-vertical diameter, this is the mantum part, and vertical is this part. Mantum to vertex. Mantum to vertex is called the manto-vertical diameter, and this diameter is the longest diameter, which is the 13 to 14 centimeter diameter. And when we have to assess this diameter in at the time of delivery, then bro presentation is showing in front of cervix. This diameter we can assess in the bro presentation, which is the 13 to 14 centimeter we can assess. After that, we can talk about the occipitofrontal diameter. So this is the occiput and this is the frontal bone. This is the occiput, this is the frontal bone. So frontal to occiput diameter. Frontal to occiput diameter is 11.5 centimeter. This is the frontal bone. This is the occiput bone. So frontal to occiput diameter is 11.5 centimeter, and this diameter we can assess the deflex vertex position at the time of delivery. After that, we can discuss the suboccipitofrontal diameter. Suboccipitofrontal diameter is 10 centimeter. Suboccipito to frontal diameter we can assess subocciput. This area we can call the subocciput, and this is the frontal. And subocciput to frontal diameter is 11.10 centimeter diameter, and this diameter we can assess the partially deflex vertex position. This diameter we can see in partially deflex vertex positions. We can assess this diameter, and in the last we can say the posterior fontanelle. This is the posterior fontanelle, which is the triangular shape. It will close 2 months after birth. 2 month it will closed in newborn, and this is the anterior fontanelle, which is the diamond shape, and this fontanelle is closed 12 to 18 months after birth. This is the complete information regarding the skull, which is very helpful to you in your exam and in your demonstration in your practical. Thank you so much.